Hello everyone, happy evening, a very good evening. I hope and I believe all of you are doing well. A quick note everyone, am I audible and visible everyone? Okay, that's great. So I think you all can hear me and see me. That's great. So this is the Fast 5 Test 7. So for those who are new here, Fast 5 is basically 5 clinical long stem questions that we discuss that have a lot of concepts to be discussed. We discuss it with concepts and we discuss it with the tricks to be remembered for that particular topic. So I hope all of you have attempted the test and you are here for the discussion. The annotated PDF will be uploaded on a Medsynapse app by Dr. Nikita in the free content tile on the home page. You will see when you go to the free content course there, which is free for all, you will see the Fast 5 MCQ discussion folder, and there you will find Fast 5 Test 7 along with the blank and annotated PDF attached to the video. You can download the PDF in your device and you can make notes in that as well. Okay. So let's start discussing the today's questions. I hope all of you have fared well in the Fast 5 Test 7. And these are the questions, that are very, very frequently asked in the exam. Okay. So starting with the first one, what do you think is the first question telling about? So learn the tricks, guys, right? Remember, cracking these exams, be it NEET PG or INICET FMG, is not just about, the knowledge game or the theory game. It's also about the MCQ skills, how fast you read the question and how smartly and accurately you answer the question. So whenever you have, the lengthy long stem clinical questions, for any question, right, be it lengthy or not lengthy, the first thing that you should be doing is looking at the options, because that gives you a quick idea about what is this question about. So radiation therapy, raising pigeons, smoking cigarette, working in shipyard, it gives you a a rough idea that maybe this is something related to some disease, occupational exposure, some exposure risk, right? So which of the following is the strongest predisposing risk factor? You read the last line first. That is what the question is asking. And then you see the second last line. So open lung biopsy shows a thick, firm, white, pleural tumor that ensheathes the right lung. So does that give you a clue even if you don't read the entire question? Right? So there's a pleural tumor, plus you see the option of working in a shipyard, connecting the dots together. The pleura, the lining of the pleura, that is mesothelium. So remember, the question is talking about mesothelioma. Okay, the question is talking about mesothelioma, which is definitely associated, right? Examiner's favorite. It is associated with asbestosis. And asbestosis is common with someone working in a shipyard. This is something that you can never ever forget, right? A basic concept that is tested in your exam very frequently. Can you tell me any other options or occupations where asbestosis is associated with? Apart from shipyard, what is the other occupation that it is associated with? Remember, the other option that can be given, it is also plumbing or roofing. Okay, plumbing or roofing can also be one of the options. Shipyard, definitely you have to remember. And apart from mesothelioma, asbestosis is also associated with bronchogenic carcinoma. Okay, bronchogenic carcinoma, adenoma is what it is associated with. Okay, another quick question that is asked in your exam very frequently. Asbestosis affects what lobe of the lung commonly? Is it the upper lobe or is it the lower lobe? This is also a PYQ very, very frequently tested. Is it the upper lobe or is it the lower lobe? Yes. Very good, Rajat, correct. So how do you remember that is? Remember, asbest is asbestosis. It affects the base of the lung, that is the Lower lobe is what it frequently affects. So next question, tell me which one affects the upper lobe commonly and it mimics TB. Which is the one which affects the upper lobe and it mimics TB? Right, so there can be fibrosis, progressive massive fibrosis in the late stages. So which one, similar to TB, affects the upper lobe? Yes. Very good, Abhinesh Prabhu. Correct. Remember, that is silicosis. You know, you have this term silicotuberculosis. So similar to TB, it affects the upper lobe. It can cause fibrosis like TB. So progressive massive fibrosis is associated with silicosis. This is also a PYQ that has been asked in your exam. Okay. Is this clear with everyone? Coming to this option here, remember that raising pigeons. What lung condition do you remember with pigeons? What lung condition you should remember with pigeons? Hypersensitivity pneumonitis. Remember hypersensitivity pneumonitis, and otherwise pigeon droppings and microbiology you read in Cryptococcus, right? Cryptococcosis, and here in the lung, remember hypersensitivity pneumonitis. Hypersensitivity pneumonitis. Is this clear with everyone? Regarding asbestosis, pathological question, what bodies do you see in asbestosis? What bodies do you see in asbestosis? It is ferruginous bodies, right? Ferruginous bodies which have what shape? The dumbbell shape. Ferruginous bodies is what you see in asbestosis. Ferruginous, ferru iron wala Prussian blue se stain hoga. So remember, ferruginous bodies is what you should remember in asbestosis. Okay? What is the most common radiological finding in asbestosis? Most common radiological finding is a pleural plaque which may be calcified. Calcified pleural plaques is the common finding that you see radiologically. The most common finding is calcified pleural plaques in asbestosis. Okay, is this clear with everyone? Can you tell me one sign that you see in X-ray in asbestosis? Anybody? One sign that you see in X-ray in asbestosis. Yes. What sign do you see on X-ray in asbestosis? The calcified pleural plaques. When you see them in phase, what sign do they give? Let me see who gets this right. Very good, Abhinesh. One is crow feet sign that you see on CT because of the round atelectasis that is associated with asbestosis. What else? Crow feet sign is what you see on CT, HRCT. What do you see on X-ray? Anyone? I'm waiting for the answer. Very good. Medico 1111. I don't know your real name. That is holly leaf sign. Absolutely right. You would see the calcified pleural plaques which look like that holly leaf. जो you know the leaves जो मोहब्बतें movie में हमने देखी है वैसा shape उनका दिखता है. Holly leaf sign is seen in asbestosis, and on CD it shows round atelectasis. Right. The crow feet sign, like someone mentioned, that is what you can see. Okay, so that was about the first question. This is how we discuss the questions, right? Revising the entire topic and the related points related to that topic. Okay, this is what we do in our test and discussions as well, retrospective learning. Okay, going on to the next one. Okay, tell me, what do you think is the answer to this question now? So again, looking at the options, acetylcholine binding, presynaptic release, something related to the muscle, impairment of which of the following is the most likely cause of these findings. There is malfunction of NMJ, and you see that chest X-ray, there's a hilar lung mass, plus there is weakness of the muscles which improves with repetitive testing. This is a very, very important clue here. Okay, improves with repetitive testing. This is very important. Very good, Asta. So this is a very important clue here, which is telling you that the muscle weakness, which is improving with repetitive testing, this is going to be Lambert-Eaton syndrome. Okay, this is going to be Lambert-Eaton syndrome. Lambert-Eaton syndrome versus your versus myasthenia gravis. What is the difference in between the two? Remember, alphabetically, if you say A, B, C, D, L comes first, M comes later. So L, Lambert-Eaton is presynaptic disease, and myasthenia gravis is postsynaptic acetylcholine receptors which are affected. Okay, so remember that if this is the synapse here, presynaptic is Lambert-Eaton, postsynaptic is myasthenia gravis. In Lambert-Eaton, there are antibodies against this voltage-gated calcium channels. There are antibodies against voltage-gated calcium channels. In myasthenia gravis, it is against this acetylcholine receptor. What receptor you have at the NM junction? It is nicotinic acetylcholine receptor. Okay? So this is Lambert-Eaton. Why? Another difference in Lambert-Eaton, with repetitive testing, there is improvement in the symptoms, while in myasthenia gravis, there is more fatigue which sets in with more repetitive use of the muscle. And that is why classical history that you generally see in myasthenia gravis is evening fatigue. The ptosis, which is more in the evening. It tends to affect the eye muscles, right? The limb muscles more. Lambert-Eaton is more of proximal muscles. Plus, what do you have in Lambert-Eaton is the deep tendon reflexes are also depressed. Plus, there are autonomic symptoms which are present like dry mouth. Okay, so this is the difference between Lambert-Eaton and myasthenia gravis that you should definitely remember. So this is Lambert-Eaton. So what is going to be the answer here? How come it is B? It is 4. The presynaptic release of acetylcholine is what is affected. Because when this calcium comes into the presynaptic terminal, that is what stimulates the acetylcholine release. So with that, what happens is the presynaptic release is getting affected. Is this clear with everyone? It is the presynaptic release of acetylcholine which is affected here. It is not the direct depolarization of muscle fibers by calcium. Calcium does not cause the muscle direct depolarization. It is the nerve ka excitation, action potential, excitation, contraction, coupling which takes place, right? So remember, the answer here is not B. Just don't look at calcium and mark the answer. Many of you have been saying B, second options. If calcium nahi dekhna hai, understand the option. So it is presynaptic release of acetylcholine which is reduced here. Is this clear with everyone? Right? Now connect the dots. Tell me, what is the importance of giving this in the question? That the patient is a cigarette smoker, plus there is a hilar lung mass. What is the importance of that? The patient is cigarette smoker, plus there is hilar lung mass. What is the connection between that and Lambert-Eaton? Yes? So Lambert-Eaton syndrome and cigarette smoking, hilar lung mass. What is the relation in between the two? Very good, Asta. Absolutely right. It is a paraneoplastic syndrome associated with what lung cancer? Squamous or small cell lung cancer? Medico, remember, it's not squamous. It is small cell lung cancer. Okay, never ever forget this. One of your last year NEET PG exam question as well. Squamous lung cancer. Squamous, remember it, write it down as squamous. Squamous has hypercalcemia as the paraneoplastic syndrome. Small cell lung cancer, SCL, small cell lung has SCL as the paraneoplastic, which is SIADH, S for SIADH, C for Cushing's, and L for Lambert-Eaton syndrome. Okay, that is how you remember. These are the mnemonics we have learned in a short course on Medsynapse app, right? So remember these tricks, mnemonics come very handy in your exam. So squamous is calcium and SCL is SCL. That is how you remember the paraneoplastic syndromes. Is this clear with everyone? Okay. So the hilar lung mass, the centrally located, you have the squamous and the small cell lung cancer, which is the peripherally located lung cancer, adenocarcinoma. Not associated with smoking, peripherally located. Remember, it is adenocarcinoma, which has the lipidic growth, right? So, and the centrally located, central is squamous and small cell lung cancer. Okay, and both of them are associated with smoking. All right, let's go to the next question now. What do you think is the answer to this one now? Yes. Is it a case series? Is it a case control study? Is it a prospective study? Or is it a randomized trial? Absolutely right. The correct answer here is this is a case control study. Why is it a case control study? Now understand the term itself tells you that case control will have cases and controls. Case matlab the disease is already present and control matlab normal, there is no disease. So the disease has already occurred in one group. So you are starting with the case, right? Plus you have a control. And in case control, what happens, like for example, in this question here, the investigators plan to analyze the clinical epidemiological characteristics of patients who tested positive for hepatitis A antibodies compared with those who tested negative. That means patients who have hepatitis A, and then you have the normal subjects. So case and control is there, and you are doing this retrospective case study. You will ask the patients for the exposure, the risk factors, right? So case control is generally retrospective, that is done. Okay, what bias do you generally get in case control study? Because you are asking the patient to recall, so remember the bias that you get in case control study is recall bias. Okay, what do you get is recall bias. Few other important questions here on case control study. Tell me that whether it is an experimental study. Is this true or is it false? Is it an experimental study? Yes or no? Is case control an experimental study? Yes or no? False. Very correct. It is not experiment, right? You are not doing anything on your own. You are just trying to do the analysis. It is an analytical study. It's not experimental. Randomized trial is where you are doing experimentation. You are giving one group a new drug, right? So that is where you are experimenting. Remember, this is not an experimental study, right? It is an analytical study. You are just doing the analysis of the exposure, the risk factors. It is an analytical study which gives you the association between the risk factor and the condition that you are looking at. It does not give you the causality, but the association. How do you test the significance of the association in case control study? Yes, what is that measure that you use for in case control study? Is it relative risk? No. Remember it as you control the case, right? You control a bad case in the OR, the operating room. So control the case in the OR, that is odds ratio is what is used for case control study. Odds ratio more than 1 means there is positive association. Odds ratio 1 means none. Remember, 1 means none. There is no association, none association. Okay, so 1 means none, that is equal that exposure in the cases and the control, so there is no association. So 1 is none and more than 1 is positive, less than 1 is negative association. Okay, clear with everyone? So that is about a case control study. Okay, so this is a case control study. Going on to the next question now. Look at this question and tell me what do you think will be answer to this one. So the first thing majority of the students, have this is that fear, the bias of fear, looking at the graph-based questions. But actually remember, the graph-based questions are very conceptual. So if your concepts are good, you know how to interpret the graph, you would love such questions and you would pray for more such questions to appear in the exam. Which of the following best describes the action of AMP? That is what you have to read here. Is it allosteric activator inhibitor? Is it catabolite activator or repressor? Very good. It is allosteric activator. Very good. Rue studies, Abhinesh. Tell me, why is this allosteric activator? So first of all, understand the term what is allosteric activator and what is catabolite activator repressor. Catabolite activator or repressor is something that you read in lac operon, right, which affects that lac operon system basically by acting at the level of the genes. Okay, the transcription that is affected, right, at the level of the genes, they are affecting the transcription. That is what is catabolite activator and catabolite repressor. Allosteric activator, allosteric inhibitor. Allosteric means a different site. They are acting on the enzyme at a site and causing the conformational change in the enzyme, which changes the affinity of the enzyme for the substrate. So activator means it will activate and inhibitor means it will inhibit. So understand, look at the graph here. All you need to look at in a graph is what is the x-axis and what is the y-axis. So it is S, substrate concentration, versus the velocity of the reaction. This is no effector here, this line, and this line is telling you when the AMP is present. So take any of this velocity. Let's take half the Vmax. Half the Vmax, if this is the half the Vmax velocity, the substrate concentration, this is with AMP, this is the substrate concentration without the effector. So tell me that when are you needing less substrate concentration? When the AMP is present or when there is no effector, that means the AMP is not present. When are you needing less substrate concentration? When are you needing less substrate concentration? So of course on the x-axis, this is less and this is more, right? So the substrate concentration required for a particular velocity of reaction, it is decreasing with AMP. So that tells you that it is activating the enzyme, right? It is activating the enzyme. And what is the substrate concentration at half the Vmax? The substrate concentration required at half the Vmax, what is it called as? It's basically the Km, right? That is what is the definition of Km, the Michaelis-Menten constant. Okay, so it is the substrate concentration when the velocity of the reaction is half the Vmax. Okay, so what is the relation between the Km and the affinity? What is the relation between the Km and the affinity? Is it directly proportional or inversely related? The higher the Km, right? The higher the Km, that means the affinity is low. More substrate is required. That means the affinity is less. So Km is inversely related to affinity. Remember, the lower the Km, that means more is the affinity. Less substrate concentration is required. So this is another important point that you should remember, very frequently tested. Km is inversely related to affinity and the FMGE PYQ, it is directly related to substrate concentration, because that is what we say, that Km is substrate concentration. Okay, right? And a natural substrate of an enzyme is the one which has the maximum affinity, right? So that is how you identify. This is also a PYQ that has been asked. How do you identify a natural substrate of an enzyme? They give you that there is substrate A, B, C, D, and this is their Km values. Let's say 10, 20, 30, 40. So out of A, B, C, D, which have the Km values of 10, 20, 30, 40. For example, tell me which is going to be the natural substrate for an enzyme? Which is going to be the natural substrate for an enzyme? Is it A, is it B, is it C, or is it D? Very good, Suraj. Remember, Asta, it's not D. It is going to be A, because remember, a natural substrate is something for which the enzyme has the maximum affinity. That means the minimum Km, right? So natural substrate is something which will have minimum Km. That means maximum affinity. And in this case, it is going to be A. Is that clear, Asta? Remember, it's not D, it is A. So this is how you identify. This is a potential question for your exam. Natural substrate is something which has minimum Km. That means maximum affinity. Okay, that is maximum affinity. Is this clear with everyone? Right? So AMP, you know, is an activator. It is reducing the substrate concentration, reducing the Km. So that means it is an allosteric activator. Which enzyme are we talking about here in this question? Glycogen, the breakdown of skeletal muscle glycogen by phosphorylase, right? You know that glycogen phosphorylase breaks down glycogen. So if you connect the dots, understand that AMP basically increases in fasting, and that is how it is stimulating the glycogen phosphorylase, so that there is increased glycogenolysis that occurs during fasting, because we are not eating from outside, so the glycogen stores from the body are utilized, right? So remember that AMP is something which increases in fasting, activating the phosphorylase enzyme, increasing the glycogenolysis. Is this clear with everyone? Right? So that was a very concept based question, and do expect such questions in your exam, right? So this is like a simple concept, but has been asked in a tricky way. So you need to practice such questions, you know, to develop those MCQ solving skills. Going to the next question, guys, the last question of the Fast 5 Test 7 for today. Again, a reminder, you will get the blank PDF, annotated PDF available in the Medsynapse app. Right, in the free content folder. So do check it out there. You know, keep revising these questions. These are very, very important. Okay, the image itself is a giveaway. Whenever it's an image based question, first check the image. Right, image is spotter image hai, ye melanosis dikh raha hai yahan pe, lips pe, and you are looking at the options. So straight away you know that what is the diagnosis. It is Peutz-Jeghers syndrome. Melanosis in the lips, the palms, the genitalia. That's going to be Peutz-Jeghers syndrome, right? How do we remember Peutz-Jeghers syndrome? Short se mnemonics yaad hai. Peutz-Jeghers syndrome. What is the mnemonic? P for pigmentation, right? Pigmentation of the lips, the extremities, hands, palms, genitalia is what you have. P for polyps. What kind of polyps do you get in Peutz-Jeghers syndrome? It is hematomatous polyps that you get in Peutz-Jeghers syndrome, right? And what is J.E. Jeghers for? These hematomas are common in the jejunum, the small intestine, that is where it is common. Plus, पेड़ जैसा या झाड़ जैसा appearance is what you get on histopath. What is that पेड़ या झाड़ जैसा appearance? That's basically the tree जैसा arborizing pattern is what you would see in Peutz-Jeghers syndrome. Arborizing pattern is what you would see in Peutz-Jeghers syndrome, right? STK11 gene is affected. Then you also know that it has the increased risk of the cancers, which is the GIT cancer, pancreatic cancer, breast cancer, right? That risk is affected. Pancreatic cancer important. That risk is increased. Plus, the polyps can act as a lead point for intersusception. So the patients can present with intersusception, acute pain in abdomen. Plus, there can be GI bleed, and that bleed can lead to iron deficiency and microcytic hypochromic anemia, right? That is what the patient has here. So there is abdominal cramping, which is there, plus there is hypochromic microcytic anemia. So remember, intersusception with GI bleed. There is occult blood positive, so the GI bleed is present, plus this pigmentation. This definitely tells you that the answer here is Peutz-Jeghers syndrome. Okay, Peutz-Jeghers syndrome. What do you have in Gardner syndrome? Gardener, remember gardener going to the garden, getting a thorn prick. हमने ये short में सीखा है trick mnemonic. So everything which is related to the skin and the deep soft tissue which is there. So skin के tumors हो सकते हैं, right? जैसे exostosis होता है, या फिर desmoid tumors होता है soft tissue का. So basically you get the skin and the soft tissue वाले tumors. Okay, the Muir-Torre syndrome also has like the skin lesions which are present, like keratoacanthomas which are present here. It comes under your hereditary non-polyposis colon cancer. Okay, Gardner syndrome comes under your familial adenomatous polyposis. Okay, clear with everyone? So the answer here is going to be Peutz-Jeghers syndrome. So that was about the fast 5 for today. Let's quickly do a quick review of what were the 5 questions or the 5 topics that we have learned today. Right? Tell me, what is the first topic that we learned today? What was the first question? First question was the mesothelioma wala question, which was asbestosis. Right, which was shipyard industry worker. That is what we had seen. What was the second question that we had seen? What is the second question that we had seen? Yes. So look at the second question that we had, the Lambert-Eaton syndrome. Right, Lambert-Eaton syndrome was the second question that we had seen, where we had seen that on repetitive stimulation, there is increased activity, right? The weakness gets better. Repetitive stimulation, it is associated with small cell lung cancer, right? And it is presynaptic voltage gated calcium channel which is affected. Next one, what is the third one? The case control study. Right, you have a case wala group, disease present and disease not present. Right, in the question we had patients with hepatitis A and people not with hepatitis A. What was the fourth one? The graph based question, where we learned about AMP being the allosteric activator of the enzyme. Why? Because it is decreasing the substrate concentration, decreasing the Km. That means increasing the affinity of the enzyme. So that is your allosteric activator AMP, right? And what was the last question that we saw? The last question that we had was the Peutz-Jeghers syndrome, the image-based question of hypermelanosis involving the lips, plus there are hematomatous polyps that can lead to intersusception and GI bleed, right? So this is how, you should be learning as well. You've solved some questions. Try to do the active recall and revision of that, because that is what helps you in a better retention. ठीक है, सिर्फ क्वेश्चन सॉल्व करते जाओगे या सिर्फ वीडियोस देखते जाओगे without doing active recall and revision in between, you will not remember stuff, right? So study in bite-sized content, do the active recall like this, do some scribbling, like these are the bullet point notes कि देख लेंगे, इसको बार बार देखेंगे तो ऑटोमेटिक याद आ जाएगा कि हमने पढ़ा क्या था, right? So that is how you actually make your notes as well. So that was about the today's fast 5 test 7. All the fast 5 videos along with the PDFs you will find in the Medsynapse app in the free content folder. And all the Medsynapse app subscribers, I'll see you tomorrow. That is 17th of September at 12:30 noon for pathology test discussion, right? So the pathology test will go live tonight or maximum tomorrow morning, and it will have 30 questions, and we will discuss those 30 questions in the tomorrow's live class in the Medsynapse app in the short course for the subscribers. Okay, all right, so I hope all of you had enjoyed this session, and that was a quick revision of very important, not just the questions but the topics, right? Thank you so much everyone, and I hope to see you all on the Medsynapse app as well. So always by your side, helping you in your journey to crack these exams. Let's do it the smart way, not just the hard way. Okay. Thank you so much. Goodbye. Take care and keep studying, keep revising, keep medsynapsing, and keep winning. Thank you.